Welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. I would like to formally bring on our guest for today, Dr. Soram Patel, who is the Global Medical Execution Director at AstraZeneca. Thank you so much for being here.
Hi, Nina. Hi, everyone. Thank you so much for having me.
Well, maybe as a great place to start, would love if you could just give us, a quick introduction and a background, just really, walk us through your journey that has led you to where you are right now at AstraZeneca.
Yeah, absolutely. I'm born and raised in the UK, and I started off, to be fair, I ran into one of my school teachers over the holidays from primary school, and she said even at that age you were
Oh,
interested
wow.
in health on school trips. So I guess going way, way back to primary school age, apparently I was picking out sort of plants and things that had medicinal purposes. That's where my healthcare journey started. But through that, I trained as a doctor in the UK. When I qualified, I spent some time and got some great experience practicing in the US, in New York, and also in India. And then found my path in specializing in colorectal surgery. Then that path somewhat evolved to being inquisitive around sort of how patients actually reach the operating theatre, referral networks, and basically broader population health. Which led me to a kind of diversified career move away from core clinical practice in the operating theatre. So I worked in a partnerships team at IQVIA, first globally and then in the UK. So we did some cool projects around transforming pathways and expanding medicines and healthcare access to broader populations. And through that, I took my step towards AstraZeneca, where again, very much in a role that involves partnership in respiratory disease area with health systems across the globe. And we do some really amazing work working with incredible sort of health system leaders, institutions, and also data and tech partners to see how we can marry up those partnerships to bring innovative medicines, access, and ultimately better care for people around the world, wherever they are.
That's incredible. There's so much that I want to dive into from your background, but I think a great place to start. I'm just so curious because you have, all of your formal training in the UK. How has your background and, you were also speaking to all of these other experiences that you had that kind of gave you that global perspective. How has this really shaped the way that you approach a lot of these complex problems that were that are always relevant in healthcare delivery and care systems and all of that.
No, I think it's a right point in that I really value my training background. I think one of the great things about how we have the training program here in the UK is that you rotate around sort of different areas of medicine and also different parts of the country. Yes, the UK might be a smallish dot in the map, but I think you sort of meeting, sort of caring for different people starts building in that empathy. And I think that's a great foundation from where whatever journey you're going to take in healthcare, being able to understand the sort of fundamentals of what matter to people when it comes to health, that sort of gave me a really strong foundation. And things that I still draw on today. I mean, sort of going through the different paths, yes, see sort of different health systems work in different ways. And I think many people often look to, okay, what's going on in the US in terms of innovation, what's happening sort of in the EU. But actually, sort of my path have done sort of work in Vietnam, in South Africa. Actually, sometimes when you don't have that developed system, sometimes that really gives sort of the seeds for really fruitful innovation. And I think it's those gems that I've been able to pick up through my journey and be able to sort of transplant or think, oh, actually, we didn't have some of those barriers or entrenched systems. Let's think about sort of these problems differently. So I think I certainly draw on not just geographical differences, but also the sort of people differences from my path through.
Absolutely. Yeah, I think all that cultural context is so important. And it's amazing that you were given that lens to really, see all these various types of health systems and cultures and the ways that people receive care. I think that sounds so enlightening.
Yeah, I went out and go and fight. Sort of not necessarily fought for it, but sometimes you've got to sort of pave your own way, right? And actually go out and seek those experiences. So sometimes like knowing, I think I always have been bitten by that curiosity bug. So wondering what I'm missing out or that FOMO. So see what sort of I can experience from different side of things that's sort of enabled me to have those different opportunities.
Yeah, FOMO is very powerful. It can definitely be a tool for good. So I love that. And to the extent that you could share, would love if you could give us, any examples or projects, any initiatives that you have kind of been involved in, just given your experience when you think about, the way that care is delivered or innovation in, care transformation or treatment services. I think just any projects that you've worked on or specific examples would be really fun to hear about.
Yeah, absolutely. And I guess this is the women's health tech. So I was trying to think of examples sort of leading up to this that particularly would speak to women. Um, I mean, I guess it's just starting with one that is based in the UK, quite a simple one. I mean, there are lots of unmet needs in disease areas, right? And sort of speaking closely to my experience, a lot of it was in colorectal surgery. There are a lot of women's, I guess, health problems that, I mean, I say this as a recently had a daughter, so become a mum for the first time, sort of things that happen through pregnancy and thereafter that affect you. So I started this initiative working with our nursing team. We saw a lot of patients with sort of hernias. We saw patients with complications after their pregnancy that affect sort of their bowel, the things that you don't necessarily want to talk about.
Mhm.
So we thought, how can we get to the bottom of this? We didn't even know the size of the problem. So that's where the data piece came in, because it was like, where can we actually get this? And partnered with some amazing patient groups to see how we could firstly get the data and then get some partners through the medtech industry to see what solutions are out there for people that have had this. There was a whole range of problems. Sometimes these problems that we've experienced, we might just be accepting of them, and they can be quite interlinked. Is it pregnancy? Is it something you've experienced before? Have you got other medical conditions? I mean, us when we're complicated, wonderful beings, that can really make a mixed picture. So I think that sort of knitting together of a sort of different, like a network of understanding, and then we had to sort of prioritize where are we actually going to focus on. Came up with this great initiative where a lot of women were having sort of led us in a very interesting direction. That one of the biggest issues that we were having was that we wanted to focus on when we were having sort of these blood clots afterwards, and that was sort of transforming what meant for future pregnancies and their lives and thereafter. So it was an interesting journey. I liked that project because it brought so many different people along the way. I can say our nurses were super powerful in that, but also made me, I guess, understand from that sort of one neat example, the interplay between why we need sort of different stakeholders and how actually data can bring everyone together around that. Like when the patients were wanting to see the data, the nurses were sort of informed. It helped us sort of devise the solution, and that was pretty cool.
That's
As one example.
Yeah, that's incredible. And I love that I mean, there's so many amazing and successful components of that story. And I really like that you're seeing like the power of data. And I think that's something that we hear so often, especially, with AI and all of these other things that are kind of happening, all of these innovations. But from kind of your perspective, can you kind of share a little bit more on really the role of data and analytics? I really like how, with this example, you were talking about how you were able to use that to kind of solution and be in a creator mindset. Are there kind of any other purposes that data and analytics can have when we think about, maybe some of the personalizations that can occur? Anything along those lines would be really interesting.
Yeah, massively. I mean, that was, yeah, exactly that kind of creation part. I mean, things that we work on now is how I think data it links a little bit back to that unmet need, but I'm a big fan of benchmarking, right? Like setting standards. I think healthcare is has always been and will continue to be an evidence-based industry. People need the evidence to lead the way, and you need really strong data to be able to create those cases for change. And here I'm talking more about a kind of national/international level, like those massive problems that we need to solve. And I think the space that I'm in now is a lot around access to medicines, and that touches on so many people's lives. And I think there where we can really use data to sort of speak to power. I say this from my sort of doctor lens with a lot of anecdotes. And I think that was one thing that frustrated us. Oh, there's that one patient we saw, oh, it's taken them however long, 14 years to research and that's really tragic. You scale that up to a national or international level, and these are like millions of patients, the numbers of life years and sort of transformations that it's phenomenal. But equally, unless you sort of unpick and expose that data, taking it from something that can be really complicated or really scaled up, something that's very simple that can speak to sort of a government stakeholder, that to actually make someone sit up and listen. So what I do a lot of now it is trying to take sort of national like disease registries and sort of identify what is that really simple, like almost game-changing data-led narrative. So how many sort of life years are we changing? What do we need to shorten that time to treatment to make a meaningful impact on clinical outcomes? What will make sort of that quality of life better for patients, and sort of do that? I'd love to say that we're amazing at doing it. I think we're on that journey, and certainly sort of on a day-to-day basis, the variation in data access and complexities drives me around the bend, but it is a really great challenge.
Absolutely. And I think the power of data, to your point of really exposing a lot of these things on a broader and systemic level, is so incredibly powerful. And I really like that you were talking about benchmarks and kind of these best in class and kind of creating these standards, you know, in your collaborations with pharma, with tech, health systems, all of these different groups. How do you kind of ensure or facilitate those conversations so that those types of best in class practices and standards can be not only developed, but also shared?
Yeah, and I think you raise a really good question, because it's one thing having the data, and then there's what to do with it, right? And how to make people, how to use it to either bring people together or sort of drive an actual change. So, I mean, different approaches, but sort of those benchmarks, I guess, sort of make people think differently. And I think what I was trying to do is bring it back to the people. So that is a person, that is a life. What does that mean in a bigger picture? I mean, at the end of the day, a lot of what we're doing is operating in cost-constrained environments as well. So you can't, I think increasingly people are wanting to see more than just clinical outcomes. We're having to show up in healthcare with sort of cost, what have this implication. A lot of what I'm doing now are partnerships with economists, and looking at really robust health economy, and also environmental is now coming into that piece as well. People are having to build that into the plan, like what is this looking from a carbon perspective? Probably this time next year will be going beyond carbon to something else. So I think that the demands are certainly greater, but also making sure that however we're presenting that data is in a very current way, but always bringing it back to these sort of touch points that people are going to have to plan, we're all going to have to plan for.
Absolutely. And it's so interesting, I think, hearing you talk about how cost and environments are now these, you know, really big driving factors that influence a lot of this decision making. I feel like cost is unfortunate, but it comes as no surprise, I think, to all of us, with just huge rising healthcare costs. Can you talk a little bit more about some of the environmental you know, considerations or factors? I think that is really interesting to see it kind of be taken, you know, with so much weight now.
Yeah, I mean, from an environmental lens, people, and I say this working in the respiratory space, and also with a surgical background, these are some kind of, when you look at health, it was said, I think, at COP28, if the healthcare sort of environmental burden was a country, it would be the country with the fifth highest environmental burden. So
Wow.
people can't ignore sort of environmental challenges that we have with delivering good healthcare. So we're not going to be able to do one without the other in the future fit world. So that I think it's sort of holding that as the heart. I mentioned respiratory and my surgical background because sort of respiratory anesthetics are some of the biggest drivers of sort of carbon emissions. So that's why it's been very close to my practice to see how we can not just cut that waste, but also look at opportunities to sort of make sure that we're operating sustainably. So I guess on a day-to-day basis, there are obviously simple things that people can do and simple changes need to sort of just similarly like how we're all doing the recycling, healthcare models need to operate in that way. But coming back to what I said before, healthcare is very much an evidence-based industry. People want to know that they're making the right choices. Which ones do they prioritize? And then, of course, there's the bigger picture of whole like value chains when it comes to medicines, sort of development. But then, if you're thinking a bit more what's relatable to people, their hospitals, hospital operating models, and sustainable care pathways is something that I'm heavily involved in when we talk about sort of access to healthcare. So I've got some interesting data that's coming out this year that looks at sort of specialist pathways and sort of carbon savings when you're sort of referring patients at the right time, so you don't let them get sort of really uncontrolled and unmanageable disease and go on like that for several years, but you're actually making that intervention earlier. Your clinical outcomes are going to be better, but also from an environmental perspective, that burden can be notably less, and we can actually start putting values on that, which helps us make more informed choices. So I'm sure we'll see things evolve, like we've seen telemedicine evolve, because all these things start to contribute, not just the way sort of medicines, treatments develop. It's a really exciting space.
That's incredible. And I'm so curious to see this data because you environmental kind of considerations are a constant, but to really hear how it's being applied in healthcare is just so fascinating to me. So I'm very curious to see these stats when they emerge later this year. That's pretty cool.
Absolutely.
I love that. I also wanted to talk to you. I think there's, from what you were describing, thinking about some of these environmental considerations, and how access, I think, is, for a lot of things, a really, really big barrier. I'm kind of curious from, your perspective and kind of have been given this global lens, what are some of like the key barriers that you're still seeing when it comes to access? Do you think that telemedicine and digital health, are they solving some of those things? Are there still some considerations that maybe folks on their call that are, developing digital health solutions should kind of also be thinking through too?
Yeah, I mean, big question. I like where you're going. Yeah, I mean, it's relative. I think the whole healthcare landscape is so broad. It can be like breaking it down, I guess, into different care settings. So I think it's sort of anyone on the call that's thinking about what are my challenges, think about your operating space. Are you in that sort of primary care lens? Are you sort of in that pre-primary care? Are you in a specialist? And because that's going to massively affect sort of the dynamic when it comes to, or challenges when it comes to access. We see vastly different issues even within that. And I think that takes that geographic element out of it. There are, I guess, from what I've seen, as I mentioned before, when I was working in sort of South Africa, remote parts of Vietnam, your sort of medicines delivery is coming every week or every other week, and you're going to sort of plan your whole environment around that. Our touch points to healthcare providers and what that meant for our care pathways, they're to be structured in a completely different way to what we were doing, say, in Canada and the US as a result. I'm not saying that it's different. Actually, some of the outcomes could result in the same, but thinking about what is that route to access and where are the opportunities to sort of shorten what's feasible, what's not, and sort of where are the priorities. I think within that, because where we managed to do that was identify what was almost not the biggest bang for a buck, but where could we prioritize first to make that big change for patients at the end of the day. That was that's my take on access, I guess, one narrow part of a bigger picture.
No, that's so interesting. Kind of thinking about like this one particular experience that you have, but I think it really does compound. And I'm sure there's so many ways that a lot of this is so relevant. Just thinking about, the route that you had and all of these ways that you can just influence kind of an already existing behavior, I think is really interesting. Yeah, I really love that. And kind of wanting to also learn a little bit more, I think one of the things that I know you kind of also really engage with, as well as like patient advocacy groups and kind of those different, components. Would love if you could share a little bit more about, patient advocacy and engagement and really, these types of components. How does that play into, the approach of healthcare delivery or just broader like innovation and transformation?
I'm so pleased you asked this question because, yeah, I really do bang on about this all the time, in that we have to listen to our patients, no matter what you do within healthcare. If you're not doing it for a patient, I know that sounds really soppy, but at the end of the day, you'll lose that meaning. When you look at people in sort of big retail corporations, everyone's talking about their customer and their end user. At the end of the day, you're in this to make a difference to patients. And I think what the role that advocacy groups play in being able to sort of bring that together, and not just sort of insights in, but also what they can feed back, and that reach is amazing. And also sort of serving as that bridge between what everyone's trying to achieve, and find that balanced win is really key. I mean, sort of where I think, linking back a little bit to what we were discussing before, how they can translate things that can be really complicated, and support that translation to patients. I mean, when you think about sort of some of the things that when you pick up a disease leaflet, or sort of now increasingly, I think that they're great. There's some of those sort of diagnostic tools, because again, when we talk about being able to access treatments and sort of access technologies earlier, I think one of the biggest evolvements that we're sort of still riding out on is sort of earlier diagnosis. How can we support that earlier patient identification? And I think that's where sort of these sorts of groups are really critical, in enabling people to sort of engage with that. We can go out sort of mining. I mean, if you think about before you're waiting to go and see your doctor to see what's wrong with you, is it an annual checkup? Not people don't even attend all of those. Whereas now, like there are just so many different ways where we're able to find out earlier. And I think unfortunately, when you've been in those situations, that gift of time, that means everything to you, right?
That's amazing. And you bring up such an interesting point really around kind of the time to diagnosis, or really just like the prevention, the screenings, all of those kind of types of things. And for you, are there, when you think about maybe the partnerships that you have, whether it's with patient advocacy groups or other industry partnerships, what are some of the things that can be done to really raise awareness about some of the more preventative aspects of healthcare, like the measures and the screenings and all of that?
Yeah, I mean, I think it's partly getting people involved, but then also understanding what is sort of the key part in the partnership that is bringing everyone together. What are we really trying to change? Sometimes you can't always change everything. So, I mean, in the I guess just to play out a couple of examples, or maybe actually pick one. So when I was in the sort of surgical world, we had a big sort of challenge. It was a sort of niche group of urological cancers, and we needed to, I mean, you need to identify those patients early. Within that, it was that sort of partnership with the patient advocacy group. I mean, we got artists involved in
Oh,
drawing these
wow.
incredible diagrams, because how do you sort of urological and complicated sort of anatomy, how do you really simplify that down so people could do these checks at home? I mean, you see now when we're all told to check ourselves out in certain ways and look out for certain signs, that's all come from somewhere. And I mean, not everyone's sort of needing to invest like 20 years to like complicated anatomical training, but
Definitely.
it's those sorts of partnerships of different, like diverse thinking, to think about how you can reach a sort of different people, be all encompassing, and also really hard to reach people, sort of in a day-to-day mind. I think that's certainly taught me a lot about broadening out sort of from really sort of complicated thinking, boiling it down to what really matters, and getting sort of that different minds in the room and involved to really have the strongest partnership possible.
That's incredible. And I also am so curious. You have such a wealth of experience from a physician lens, being a provider. Also wanted to kind of ask, kind of more from just the work that you do, kind of more in that business aspect. I know that you're a member of the Healthcare Businesswomen's Association. So would love if you could share. I mean, I think it's so important, the role of community and what it can do to not only have champions and advocates in your corner that are all kind of serving a common purpose, but would love if you could share a little bit more about the what you've kind of found when it comes to being really involved in these types of associations, and kind of the beauty of community.
Yeah, I mean, I love being part of the Healthcare Business Women's Association. I think women's networks are fundamentally important. We go through sort of different journeys in our lives, so different networks work at different times, and we're also having that core group that have an understanding of people that you can go to. I mean, I do think I sort of look back and create, the opportunities have very much come from a network, the sort of support or way you're thinking. I've been in those situations where you're kind of like losing way or thinking, as we said right at the outset, what am I missing here? What are the parts that I want to get more involved in? Much of this comes through the people that you meet in networks. And I guess, yeah, sort of case in point to me, I've had quite a diverse change in different sort of companies and public sector, private sector. I've managed to scope out a little bit, or get a bit of insight from different people. It's yeah, and also I guess building sort of these relationships within business, thinking about sort of challenges, puzzling what you do on a day-to-day basis, but increasing that pool beyond that echo chamber of the people that you see day in, day out. I think breadth of thinking is key when we're in fields that require massive innovation. So yeah, I'm super grateful for all of the women that I've met through the network and continue to have great relationships with. It's like a massive phone book, right? You have your kind of like call my friends, but beyond that, who you're going to call on? It's endless.
That's amazing. And I realize that we are at time, but I can't let you go without asking what is one of my favorite questions, which is, you are an incredible expert. You have so much wealth of experience. Do you have any words of wisdom, whether it's something that maybe a mentor had told you or anything that you have found that's really grounding that you can kind of share with us, anyone that's maybe on the call that's a younger professional kind of looking to do what you're doing, any advice or words of wisdom that you have?
I'm a simple soul when it comes to it. So I guess when it something that's always really helped me is what is your message? And I translate that, sort of use that in many different sort of settings, whether it's sort of for if you're in a presentation, like what is the one thing you want people to take away from this? When thinking about a research paper or something, what is the one thing that you want to land? Whether it's a consultation with a patient, what is the one thing you want them to take away and get across? So yeah, I would just say, what is your message? And try and make it just one. So that's been a gem that I think someone passed to me quite early on in my career, but I try and speak to it very often.
That is a good
Probably
one.
trashed it today though by bringing in so many different points to answers.
No, this was perfect. And that is such, I'm gonna, it was passed down to you. You gave it to me. Now I'm going to pass it down because I actually really like that a lot. So
Gift
thank
of
you
giving.
so
Take it,
much.
Nina.
Yeah, thank you so much for such an incredible conversation. Really appreciate you taking the time to chat with us today.